Hello, my name is Jewel and welcome to my project, which will discuss skin breakdown prevention and management. This change project was inspired by working in home care as well as a nursing home where I have witnessed a lot of patients not being turned every 2 hours or no real practice when it comes to preventing skin decubiti. In this project, my intention is to offer information about what skin breakdown is and steps to take to prevent it or manage the ones that are already existing. I hope that you find it informative. Hello and welcome to my change project for skin breakdown prevention and management. These next few slides show the assessment and implementation process for change, tools utilized, and evaluation methods of success. The institution used was a long-term skilled nursing facility which comprises of mixed ambulatory patients. These patients could be bedbound, they can be wheelchair bound, or they're able to walk on their own. The status of these patients often change, and so necessary screenings are important to determine the best plan of care for skin breakdown prevention. The purpose and goal for this project is to identify assessment tools used to screen at-risk patients, determine if necessary interventions are implemented, and to evaluate intervention methods to quantify success rate. RN supervisors will frequently check patient charts to ensure up-to-date documentation completion. Care plans will be updated. Necessary consultations will be ordered for improved skin integrity, and treatment medications and tools will be evaluated and changed as needed. So what is a pressure ulcer? A pressure ulcer is injury to skin and tissue caused by localized pressure and tissue damage. It frequently develops in bony areas of the body such as hips, heels, and tailbones. It develops quickly and some can be treated but most cannot. Prevention is better than cure when it comes to pressure ulcers. Pressure ulcers remain a major health problem affecting approximately 3 million patients. Pressure ulcers are costly with an average charge for hospital stay at $37,800. Pressure ulcer prevention takes a multidisciplinary approach and nurses play a key role. The rate of occurrence in skilled nursing facilities is 2.2 to 23.9% and home care 0 to 17%. Identifying at-risk patients. The following slides show the tools that are used to evaluate patients who may be at risk. The first step is to identify at-risk patients. This is a process. Patients would be identified upon admission as being at risk for skin breakdown. Factors that contribute to skin breakdown include weight, nutritional status, and mobility. In-house assessment tools will be utilized to determine risk factors and care plans. In-house assessment tools are utilized from pre-admission to admission to determine skin status. Forms such as skin risk assessment and RAP review, resident assessment, fall risk assessment all assess the mental status, weight, incontinence, mobility, and fluid intake of patients. Studies have shown that these screening specifics, when implemented, help to greatly reduce the risk for skin breakdown. These include daily skin moisture management, daily skin assessments for all patients, improvement of hydration and nutrition, and minimizing pressure. A score of 15 or more on the skin assessment and RAP review calls for further investigation and care plan evaluation. In-house assessment tools are used on pre-admission and admission and are filled out by the admitting nurse. Consultations for other departments are also made based on scores. Dietary, physical therapy, speech therapists are some of the other departments that could be involved. The tools also determine the patient needs for skin treatment, dietary management, and bowel and bladder training. Interventions and evaluations of plan of care. What works and what does not work based on evidence-based practice. Here are some of the implementations and evaluations of some of the things that are performed at the Skilled Nursing Center. Activities of daily living are performed and documented by the certified nurses' aides. Certified nurses' aides also do hourly rounds to check on patients. This is for safety. Frequent repositioning as needed, as too often patients are sat up in a chair by 4:30 a.m. and do not go back to bed until 9 a.m. Dietary consultation. Patient's weight is recorded and analyzed over time to determine any change in nutritional status. Fluid intake encouragement for patients who qualify. Urinary incontinence documentation. Episodes are documented to offer better time management and training. Patient and family education. Patients who are cognitive are instructed to ambulate as tolerated and call for assistance if needed for incontinence. All members of staff are responsible, including patients and family members. The care team involved constantly evaluate the patient's development by assessment, documentation, and review of implementations. Success rate is based on a 0 to 1% report of skin breakdown and improvement of previous skin breakdown. Evaluation. Implementations. Frequent positioning as needed. Frequent positioning proved challenging as high patient to care provider ratios meant that time management was an issue with too many high-risk patients and too little staff. Daily skin assessments proved successful as nurses assess patients' skin on each shift in between MedPass and perform treatments as necessary. Nutritional status and hydration proved a challenge as patients had proved to be non-compliant to dietary changes and hydration. Mobility aids such as cushions and mattresses had to be approved by the right department, including insurances, and were often too expensive. Patient ambulation equipment. Bariatric patients were most prone for getting skin tears as equipment were at times not the right size or fit.